Hi, a very good afternoon to everyone. As you know, 2020 has seen an unprecedented global pandemic called COVID 19. So, the whole world is fighting against this disease. And more than 15 million cases we have around the world, and more than 6 lakh deaths has taken place. Not a single country has been able to uh, get escaped from this disease. So when we talk about our country, India is also has got more than 12 lakh cases now, and thankfully the recovery rate in India is good. So the central government and the state government is trying their hard to ensure that all people get tested, treated, and the awareness in the community should be at maximum, so that people adopts the preventive measures of hand washing, social distancing, respiratory hygiene, etc. So in that backdrop, as you know, there are four important dates, which is very important for COVID 19. If we go in the history, this COVID 19 will have four important dates. The first was, 31st December, when first time pneumonia of unknown etiology was reported from Wuhan city, uh, China, and then on 30th January, when WHO said that it is a public health emergency of international concern. 11th February, no, the third date which we should remember always, this disease got its name as COVID 19. And on 11th March, again WHO said that it is a global pandemic now. So, based on this small background information, which already you all know, so every government means is trying their level best to fight this. So, currently, it has been always a debate who should get tested, who should not get tested, what is the criteria of testing. So, the guideline keeps on changing. So, the revised testing strategy by ICMR, which has come down. So I just try to make sure that you understand who all are eligible for testing for COVID. Okay, so let's start. So on 18th May, ICMR came with a strategy that following, eight categories will be eligible for testing. Now, what are those eight categories? If you see the first one says all symptomatic individual. When I say symptomatic individual, means the person may be having influenza-like illness symptoms. So all symptomatic individual with a history of international travel in last 14 days. So eligible candidate for COVID-19 testing. Second, the same all symptomatic individuals who have come in contact with a laboratory confirmed case. So he is also eligible for testing. Third, all symptomatic healthcare workers or frontline workers involved in containment and mitigation of COVID 19. So, healthcare workers, frontline workers working in containment zone or working for mitigation of COVID 19, they are also eligible for COVID testing. Fourth, all patients of SARI, means severe acute respiratory infection. So they are eligible for COVID testing. Now, if I say, take this four criterias, four categories. So if you see the commonalities in four categories is that they are having symptoms. Okay, they can be ILI or SARI. So if it is SARI, definitely they have to go for the testing. If it is ILI, then we add three clauses to that. First, international travel. Also, we can also think of community transmission. If they have a history of travel from community transmission area. Second, came in contact with a confirmed case, and third, healthcare worker working in the containment and mitigation of COVID-19, and they are symptomatic. So these are the four criterias first, which are having symptoms. In addition to that, we add a clause of travel, we add a clause of laboratory confirmed case, we add a clause of healthcare workers working in containment zone or containment or mitigation of COVID-19 and SARI. The fifth one is slightly different, which says that asymptomatic, direct and high risk contacts. So the person is asymptomatic and is direct and high risk contact of a confirmed case. So if a asymptomatic contact who is in high risk comes in a contact with a confirmed case, need to be tested between 5th and 10th day of coming into contact. So this is important. This is slightly different. So any asymptomatic high risk contacts, direct one, coming in contact with a confirmed case has to be tested between day 5 and day 10 of coming into contact. All symptomatic ILI patients living within hotspots or containment zone can be also tested. All hospitalized patients who develop ILI needs to be tested. All symptomatic ILI among returnees and migrants within 7 days of illness need to be tested. So these are 8 categories which need to be tested. The ninth one is not primarily, it is not a category. It says that all emergency procedures should not be delayed just because the test is not done. It should start. However, the testing, no procedure or testing should be initiated at the earliest. It should be done. So these are the possible 8 categories and one emergency one. So this is the revised one which Government of India says that these all people can go for testing. So there is a lot of confusion who should go for testing, who should not go for the testing. So this are the, if you fall under this criteria, you can go for the testing. Two important things, as you see, we were talking about ILI, we were talking about SARI. So ILI is respiratory infection with fever 38 degrees Celsius or more and cough. SARI, when we say, it is acute respiratory infection, you have fever 38 degrees Celsius and more and cough, and it requires hospitalization. So this is ILI and SARI. So in COVID, the best thing we should do, that we have to be well informed. No? When I say well informed, we need to be updated as far as the guidelines are concerned. So what I will try, and I have received requests that in view of changing guidelines, I will keep on posting small videos which focuses on the recent guidelines of related to COVID-19, so that you get updated. I hope this has helped you. So in future, I'll also come with small videos on COVID and other topics related to public health, which will help you to understand and comprehend the subject very nicely. With that note, thank you for watching. I hope this has helped you. Thank you. Take care. Bye bye.